We just finished an epic Q&A episode that may end up being 2 episodes. So if you're watching this, it's probably because we decided this would work better as 2 episodes. This is the second half of our Q&A episode. A bunch of questions. Because they're unrelated topics, it doesn't really matter where they get broken up. Enjoy. Let's jump to Bev, who got a message to us at the office. She said, I've been trying to research calcium and taking Armor. Armor is a thyroid medication? Mm-hmm. Okay. I know not to supplement calcium or biotin within 4 hours of taking thyroid meds, but I've been trying to find out about calcium in foods. I eat breakfast an hour after taking the Armor, and there's about 65 milligrams of calcium in my breakfast. Is this a concern when absorbing the calcium for interfering with the thyroid meds? I also read that estrogen in cream form should not be taken close to thyroid meds. Do you know anything about that? Thanks, Bev. All right. I know nothing about any of this, so fill me in, Dante. What's going on with calcium and thyroid meds?
Yeah, good questions from Bev here for sure. So the big point that she captures in her question initially is the importance of separating thyroid medication from calcium-containing foods and just foods in general. So anybody who's taking thyroid medication, they should have been counseled on trying to separate their initial dose in the morning by about an hour or so from any other foods, really.
Why is that?
It's a drug that is more sensitive in terms of its absorption to other foods.
Okay. So if you have the calcium too soon, it will inhibit the drug's effectiveness?
Exactly.
Got it.
And so in treating hypothyroid in this case, you are often going back to look at blood work to see changes over time, trying to corroborate that with clinical symptoms.
Yeah.
And if you are not controlling for the variable of how is this drug being absorbed by taking it with food or taking it at night or being inconsistent, this is one that's just a delicate balance to strike at times for people.
Some medications you don't have to be as careful with. This isn't one of those.
Exactly. Again, so I think that Bev does a really nice job and sort of exemplifying the importance of that. You know, it sounds like something that's not the end of the world, but like I said, for those that have dealt with thyroid issues, they're playing with doses. It's a little bit challenging. This is maybe one thing that you can control for. So,
okay.
So with that out of the way, to kind of address her point, the way that she's separating it currently is definitely sufficient. So again, that 1 hour mark is critical, even with the amount of calcium that she's described that she's taking. Now, in general, so in theory, if somebody was drinking a lot of milk, like a lot of almond milk, a lot of cow's milk, maybe the recommendation might differ slightly, but doesn't really seem like something that needs worried about. Not to keep harping on this, but a lot of times people will, they drink juices in the morning, and those are rich in caloric content. And so that's something to consider. In taking this medication on an empty stomach, that means no sweetened beverages, no drinks, no orange juice, though that matters too. So
it's like coffee with nothing in it, or water or tea with nothing in it, but that's kind of where you have to draw the line early on.
And even, I'm glad you mentioned coffee, because there's even some research showing that coffee has the potential to change maybe the absorption of thyroid medication.
Okay, so not coffee.
So that's a good point.
So water.
Yeah. So it just seems like we're being overkill, but again, this is a good one that just try to separate it for the most part. Now looking ahead a little further, the question, the part of the question that's referring to the estrogen replacement therapy.
Yeah.
My take on this is that it does factor in. So estrogen replacement therapy does factor into the whole equation, but more of a big picture sense. And so adding estrogen replacement therapy to somebody who is already taking thyroid hormone replacement in the form of Armor,
right,
does have the potential to lower T4 in the blood.
Okay.
this is not ideal if you have hypothyroidism, as you are trying to keep these levels constant, trying to keep that in that range where you are no longer having clinical symptoms. Oftentimes, individuals will require dose changes or dose increases on the thyroid medication to address this. Now, from my understanding, changing or separating the administration, if you find yourself on both of these medications, in an acute setting, so similar to separating the calcium in the thyroid, separating the
estrogen cream from the thyroid medication.
Yes, is not, again, just looking at this from a kind of a conceptual standpoint, there's not going to really be a meaningful effect there. While it's a good thought, but it's more about the long-term use of these medications together. And then, we're totally neglecting the complex interplay between the actual endocrine systems in the body too.
Right.
There's these hormones are naturally present and are constantly interacting, and there are feedback mechanisms and such that are occurring. So
yeah, you're kind of affecting both ends of a scale at the same time.
Yes. Now, as long as anybody's symptoms and blood work are generally in a stable place, i.e. the hypothyroidism has been well controlled, then again, this is just something we're not super worried about. Now, to her point, there is some additional evidence indicating that topical or transdermal, technically estrogen in the form of creams, might have less of an effect on T4 levels in the blood, versus the oral estrogen replacement. So that's something to consider.
So this might be a better version of that for her.
Exactly.
So if I understand correctly, what you're saying, separating out the breakfast from the thyroid medication, probably a good idea, but an hour should be sufficient. You're doing great. Just keep that up. And as far as the estrogen is concerned, the timing won't matter nearly as much as the fact that you're taking estrogen and the thyroid medication. Those two things that's enough of a handful on its own. Don't sweat the timing there. Very cool. Bev, I hope that helps. Let's see what else we got. This one, Joey, Denise wanted to know what supplements can affect cholesterol. Direct and to the point. I like it, Denise. Thank you.
Yeah, I'll try to give a pretty direct answer here. If, again, your cholesterol numbers are high, and you obviously need to discuss that with your doctor. And if he's recommending a medication, this is not meant to, get in between that at all.
Right.
But what we have seen over time and years of recommending supplements is that, we can get some movement in LDL with two supplements in particular. Red yeast rice has been a mainstay for a while. 1,200 milligrams a day of red yeast rice. So you want to make sure if you're going to do it, you do at least this full 1,200 milligrams. There are some studies showing up to 2,400 milligrams. Red yeast rice can be a little controversial in the sense of its relationship to a statin. We'll have people come in and say, oh, does your red yeast rice have statins in it or those kind of things and those types of questions. But there is definitely the presence of what are called monocolins. Monocolin K is essentially what was the first statin developed, lovastatin. So, for example, in 2010, they tested 12 products and found that the monocolins ranged from 0.31 to 11.15 milligrams. That 11.15 milligrams is getting up to medication type numbers. So it's just something that you do want to be aware of when you're selecting a supplement. It's not bad that there's monocolins in there. And in fact, it's probably what's going to help it work.
That's
doing. Yes. Okay. Yes. It's going to be at lower doses, milder activity. The other thing about, in terms of if you are looking for this supplement, citrulline is a common toxin. In 2021, very recently, 37 different red yeast rice products were evaluated, and only one was below the maximum level currently set by the EU, the European Union. So be careful with that as well, in terms of, again, going with a company that you trust.
Like the essentials products on our website at askjoedimatteo.com.
The other one is bergamot. Bergamot also, is definitely dose dependent. You want to make sure you're doing at least a gram typically twice a day of dosing. And that has shown to have a little more of a wide ranging effect. Again, we're not talking anywhere near the studies in depth that statins have. We're not, looking at outcomes. We're simply talking about, biomarkers. But relative to red yeast rice, there have been a little more studies regarding a bigger picture of lipids. So all blood lipid markers, HDL, LDL, total cholesterol, have been shown to be positively affected by bergamot supplementation. There are also some different inflammatory proteins that have shown to decrease with bergamot supplementation. So at least 2 grams a day if you want to get movement there, and also don't recheck. They say 8 weeks, but I would probably do at least like 3 months, 12 weeks, and see if it's working for you. Again, stay in contact with your physician in terms of, where to go from there. But just answering the question at face value, if you've had maybe some side effects with statins, or you're really hoping to not cross over, and that's what you want to do from, non-medication to taking something, this can at least be something, an option for you to look at.
Absolutely. Yeah. And Dante, you mentioned earlier, a couple lifestyle changes, reducing saturated fat. Always a big thing.
Mm-hmm. And the key there too is even what you're replacing it with. So avocados, nuts, and seeds, and those sorts of, and other, fatty fish and such.
Absolutely.
Also increasing fiber intake and, weight management, which is, critical across multiple domains here. But the key is, striving for that reduction in waist circumference.
Adipose tissue.
Mm-hmm. And so all of those things can go right in tandem with what she's looking to do with supplements, what she's looking to do or not to do with, medications and such as well. It's
absolutely. Very, very cool.
Multi-pronged approach.
Yeah. A great way to hopefully take a natural approach to a very common issue. If you want to know more about cholesterol, we have an entire episode about that. Episode 13 is wholly dedicated to cholesterol. One of my favorites. Let's see what else we got. Michael emailed us. He had a question. He emailed us questions at askjoedimatteo.com. Michael said, are there any natural supplements or ways I can increase my white blood cell count? What is that about?
Yes. So when we're talking about a low total white blood cell count, we're referring to what is called leukopenia.
Okay.
And so that can occur as a result of a decreased production in white blood cells, or an increase in destruction of blood cells, or some combination of both of these things, which sounds a lot like our discussion about red blood cells in our anemia episode. So in general, when you have a CBC or a complete blood count done, that'll give you a total white blood cell count, or what is referred to as leukocytes technically. But there is just so much more to it than that. When you break down that when you look at the differential, really is what it's called, you'll see granulocytes, you will see agranulocytes. And so the difference in those categories is they're just referring to these subtle differences in the makeup of the cytoplasm of these cells. So the granulocytes are neutrophils, eosinophils, basophils, and then the other category, we're looking at things like monocytes and lymphocytes. And so the reason I mention these is, not to make your eyes glaze over, but more so to say, Michael, what are you trying to lower? Or excuse me, what are you trying to raise? Why are you trying to increase this white cell count? Is this just another way of asking, hey, how do I boost my immune system? Because we know that we have this, there's an association with white blood cell counts. You look at these counts, oftentimes, somebody's getting sick quite often, or maybe they are on, chemotherapy, for goodness sake. And there's, you're always trying to measure how the treatment is affecting, different markers of your immune system. And so,
so white blood cell count is kind of a proxy for immune function.
It is, but it's just such a, it's such a large, complicated topic that if you're looking to, improve your immune function, let's say, by going right at the overarching categories of white blood cells, is maybe not the most optimal way to do so. Because really, in a vast oversimplification, it's not that you're trying to amplify or increase the amount of white blood cells, especially if they're relatively normal at relatively normal levels. You're trying to strike this balance of pro-inflammatory and anti-inflammatory mediators and chemicals in the body.
Right.
So it's not just about like, let's add more
right.
troops to the army. It's how do you, best support that? And in general, yes, there are some, supplements and things that you can add if you're really adamant about, improving the ability of your immune system to fight infections and such. But in general, it's the common recommendations. It's getting high quality sleep, exercising, paying attention to certain things in your diet, smoking, alcohol use, all of these kind of big picture lifestyle changes are the ones that are driving issues with immune function.
Okay.
And ultimately, the one thing I didn't want to lose sight of is that, if you look at like an isolated case of leukopenia or a, primary leukopenia where there's kind of no other known cause or anything else supporting
any obvious indication why that would be the case.
Yeah, it's possible, but it's generally rare. So if he had some blood work done and this was the only thing that they saw with no other explanation, and they ran a whole other gamut of tests and such, then that would make this a different conversation. But usually when somebody, just for color, when usually somebody has blood work done, has this differential done for whatever reason, it's essentially just prompts other tests. It prompts other investigation, because in general, they're not going to try to artificially, if this is something you're trying to treat, let's say, you're not trying to artificially change your white blood cell count. You're not attacking the count. You're trying to attack the root cause here. Is it a malignancy of some sort? Oftentimes cancers or blood cancers and different cancers are associated with, certain changes in these types of cells. So it's serious. It's a serious thing that takes a lot of investigation on behalf of the clinician. Again, infections, malignancies, other medications, autoimmune disorders, thyroid disease, overactive spleen, where blood cells are being normally filtered, where blood cells are normally filtered. In this case, they're being, filtered out and removed too rapidly.
Yeah.
There's other nutritional deficiencies. There are immune specific leukopenias. And so it's like I'm just hitting Michael with information overload here.
Right. Well, it seems like it's because there's a dearth, a lack of information in the question. Mm-hmm. The question implies a whole bunch of other questions, none of which we have any information about. So why would you want to raise your white blood cell count? That tends to be a symptom or a side effect of greater issues. The greater issues are what you need to be worried about, usually, not just the white blood cell count. Is that what you're saying?
Yeah, exactly. And I think that, it's not always the most helpful for the listeners to answer a question like this, because then you makes it sound like, oh, we're just going to hit them with more questions about the question. And it's annoying, but I think in this case, it is just useful because there's a part of me that, on behalf of the listener, just wants to frame it in such a way that's like, okay, maybe he's just saying he wants to boost his immune system, and he knows that white blood cells are greatly associated with with your immune system. They're a snapshot into how your immune system is functioning.
Sure.
And the ratios of these certain white blood cells matter and all that sort of stuff. And so it's just to say, hey, let's back up a step. There are ways to attack improving your immune system and your immune function. But let's look at this a little more globally.
Yeah, that's good, because when I first read this question, I was like, oh, great. A new thing I need to worry about, my white blood cell count. I don't know it. I was good. Now I have to freak out about that too. Cool. So I'm glad to hear that there's actually a lot more going on. Mm-hmm. Very cool. All right. This one is an email from Kathy. She said, we have an employee that is very much like our own daughter. She was recently diagnosed with lupus. She has been getting sick a lot, mostly upper respiratory issues. She had influenza A twice in the last couple of months, and she does now have a rash on her back. We have more research to do, but in the meantime, are there any vitamins, etc., that you can recommend? I saw an article that said to stay away from vitamin E. Also, make sure she takes vitamin D. Please let me know of any products that you might have that help. Thank you, Kathy. That's a rough diagnosis.
Yeah, for sure. And I'm very sorry to hear that. I think there's just a couple things to touch on here. One thing that I think, is an obvious question is related to the vitamin E. Really, is there a problem with taking vitamin E? I could not find any benefits or problems. So I'm not quite sure maybe if there was a study or there was an article that she's referencing there. I didn't see that.
Okay.
So again, neither pro nor con there. The vitamin D is definitely interesting. There is a study I'd probably recommend that you look at. It's from 2018. Autoimmune Highlights Journal, but it can be found on PubMed Central. It's regarding role of vitamin D deficiency in lupus. And I think what's interesting too is they state that vitamin D definitely has an immune modulating effect, with lupus being a autoimmune disease, and they're not sure if it's a risk factor for vitamin D deficiency or just a consequence. But either way, there is a significant association. And in this study, they looked at different parameters of supplementing with vitamin D. And there was improvement, not just in the D level, but in certain markers and certain symptoms of lupus. And, as time goes on, that could definitely be something, I'm sure, initially there's bigger things to look at, but this could definitely be a piece of the puzzle. See what her D level is, have your doctor take a look at this study, discuss it with them. It could be, again, just a piece of the puzzle. And I linked it because, again, with vitamin D and its, immunomodulatory effects.
Right.
So, I think that's definitely a place to start. If she just wants to start taking some vitamin D now, I think, 1,000 or 2,000 units is very safe. If she has an active infection, there's nothing wrong with for a period of time while sick, going up to 5,000 or 10,000 a day. But I would definitely want to see what the level is and maybe just, take a look at that big picture. Vitamin C as well. I know that with increased stress, obviously with all that she has going on and you're sick, vitamin C levels have been shown to drop. So I think that it's a good thing maybe to take, at least while sick, 1,000 to 2,000 milligrams of vitamin C a few times a day, back down if there's any loose stool. Probiotics are always a good recommendation. When you're dealing with immune issues, I think one basic good quality probiotic a day can be of help. Mm-hmm. There is, kind of getting more into this kind of supplement realm. We carry something called Virostat. It's a combination of herbs as well as nutrients. So it's got, your vitamin A, vitamin C, pantothenic acid, B12, zinc, all working together. Again, we can go into these individually, but I think it's outside of the scope. But it also has herbs like echinacea, astragalus that have been shown to help immune function. I think the key thing with something like this is while you're sick, to do it very often, 1 or 2 capsules every hour. These are not cures. These are not guarantees. They're just safe things that you can do, to potentially mitigate, some of the sicknesses that have been reoccurring with her. And I'd be remiss not to mention, more lifestyle interventions. Fatigue is a very common, issue to deal with in lupus. Make sure that sleep is paramount. Diet as much as you can, fruits and vegetables. I know it's probably difficult right now, but exercising also is critical. Basic hand washing, anything you can do just to help your immune system function at its best. And then again, I do, relative to supplements and the direct question and the link of vitamin D, I would really be, recommending that to be looked at as well.
Okay. So the things you mentioned were vitamin D, vitamin C, probiotics, and Virostat. Mm-hmm. Very cool. All right. I hope that helps, Kathy. I hope that helps that employee. And that's it. That's a rough call. Good luck. Good luck. All the products that we mentioned, and we mentioned a lot of them this episode, are available on our website, www.askjoedimatteo.com, AskJoedimatteo.com. That's where you can find any of those products. You can also sign up for our email newsletter. You can submit a question. Those come to questions@askjoedimatteo.com. You can find past episodes of this show or the show that started all of this, the Ask Joe DiMatteo show, all there on that website, askjoedimatteo.com. Show notes, everything we referenced will be available down below. If you want to know more about any of that stuff, just hit those links. You can read about it for yourself. We highly encourage you to do that. We want you to be informed. Don't take our word for it. Do your own research. If you learned anything from this episode or from a past episode, if you saw something and you go, oh, my Aunt Sally deals with that, share it with them. That is the best thing you can do to help both them and to help us as well. Share these shows with people that you know and love who you think can benefit from them. Also, leave a 5-star review or give it a thumbs up. All that stuff helps too, but the biggest thing is share the episodes. Big thanks, Josiah Schweinberg, our engineer. Thank you, my friend.
I thought you said Schweinberger.
No. Should I?
No.
Would you like me to?
No.
Okay. Josiah Schweinberg, our engineer. Michael Deppish, the editor. Joyce Gibb, our nurse practitioner who handles private consultations. Diane Silverman, who manages our products. Terry, who does scheduling. Cecilia, who does distribution. Big thanks to Joey DiMatteo, Dante DiMatteo. I'm Tyler Andrews, and that is it for us this week. Have a great week.